Welcome into another episode of the Strength for Your Purpose podcast. Hope you all have had a great week. I know I have, and we are keeping it rolling here with another awesome conversation, this time with two recurring guests. That's right. You both are recurring guests now because you've been on at least once. And really excited about this conversation because this is something that in varying degrees, all three of us on this episode today have some background, some personal experience, some expertise, or are passionate about working with. And we are going to be diving into conservative treatment of concussion in what we would call maybe a post-concussion syndrome phase. So I don't want to dive too into the weeds on that yet because we're going to get into that conversation, but want to introduce these two awesome guests for you. We have Dr. Andrea Smith of Synaptic Chiropractic, and someone you all heard from just 2 weeks ago, Dr. Lauren St. Pierre, who works with WorkFitME Mobile PT as a part of the WorkFitME team. So, Dr. Andrea, thank you so much for always coming on. Really appreciate it.
Thank you for having me.
Of course. And Lauren, thanks so much for coming on twice in 3 weeks. I also really appreciate that.
Oh, of course.
So let's start, Dr. Andrea, let's start with just like a general definition of concussion, because I think I think people think they know what it is, right? And maybe we can talk a little bit about how we classify discussions and how that's changed a little bit too. But what's kind of the definition? What's kind of going on there? What do we see when we have a concussion?
Yeah. So, I mean, if we're breaking it down like super, super basic for anybody who's in the medical community is going to be like, oh, it's so much more than that. We're going to go super basic with the definition of that. So basically it's concussion's a traumatic brain injury. So it's a TBI seems to be like the thing that everybody knows when they hear about it. What happens? It's either a bump, a blow, a jolt to the head or neck region. And what's going to happen is that brain's going to bounce forward and backwards and create not so much a structural injury, but what we call a functional injury. So a lot of CT scans that they read after a concussion, they're not going to see anything on it. There's not going to be any actual visible physical damage, but what it does is it creates chemical changes in the brain by damaging brain cells, stretching brain cells. So that's a very basic definition of what a concussion is. So.
Yeah. And the classifications of all those things have changed over time. So I'm really glad you brought up the term TBI, because I think a lot of people think traumatic brain injury. They think in a car accident, your head goes into like a windshield or something like that. You know, something much more severe where someone's like hospitalized and hooked up to every tube imaginable. And there's a scale of measuring TBI as well. But we now know that at a small level, well, sometimes not always small, but on the smaller end of that TBI scale is where concussions lie.
Yes.
Because of that actual change in brain tissue that does happen. So Dr. Lauren, talk to us a little bit about kind of the variety of symptoms we can see, and why there is such a big variety, and how that combination is going to be different for people maybe who suffer the injury the same way, right? Like, so, you know, you might have two people involved in the same incident that both wind up with a concussion, but the symptoms in each of those individuals winds up being different, even though the force and the blow and everything might be the same.
Yeah. So I guess, I mean, symptoms of concussion can be very varying. You can have a headache, right? That's like the most simple one that everyone thinks of. My head hurts. You can have vision changes. You can have sensitivity to light, and you can have sensitivity to noise. You can have dizziness. You could feel unsteady. You can even have symptoms of how like your body responds to activity, right? Your respiratory rate can get quicker, easier, right? With less strenuous activity. Your heart rate can go up with less strenuous activity. Those are all kind of symptoms of a concussion. Fatigue. I mean, the list is pretty much almost endless.
Mm.
And I think, concussions can affect people differently, and you might not have the same symptoms because everyone is different, right? So
Mhm.
your brain makeup could be different. Your brain makeup could be different because you've had concussions in the past, and this is your third or fourth concussion. Um, your brain makeup could just be different because maybe you have an autoimmune disorder, or you have inflammatory markers, or you're younger or you're older. So, all those things affect, your symptoms of a concussion. And I think too, you can just have different symptoms just because you have different symptoms. Your body is recognizing different things.
Okay.
With that injury, I don't really think any one, two concussions are exactly the same. And I don't think they can be categorized, just based on like one or two symptoms.
Mm.
There's so many different things that you can experience.
Mm.
Mhm.
Yeah.
Yep.
Yeah. I say this to folks I work with all the time. We know so much about the brain, but at the same time know probably the least about it compared to every other organ
Mm-hmm.
or every other part of our body. And that's just a really great example when you start talking about how different, even if we remove concussion from the situation, just how different people respond to like neck pain or back pain,
Mm-hmm.
or how those things
Mhm.
present and how varied it can be with what they respond to and how quickly they respond to it, which a lot has to do with our nervous system and our brain as well. Pain in general does, but when we have actual change or damage to that very complex tissue, that it's a pretty big wild card.
Mm-hmm.
Pretty big wild card. So I already alluded a bit at the top of the episode to, kind of looking at more of what we would call a post concussion syndrome period, or more of a chronic uh symptoms as to where we're going to speak on today. And the big reason for that, for those listening that are unfamiliar or who are familiar with concussions, is that acute phase, as we know, is very, very symptom limiting. So what we mean by that, as we further this discussion here, is your activity and what you're doing treatment wise and what you're doing to improve things on a day-to-day basis is based on the activity you do, whether it be physical activity, whether it be your exposure to screen time, whatever the case might be, and how that affects your symptoms, makes them more noticeable. So, but once we get
Mhm.
beyond about, I believe the real current standards are probably like a 10 to 14 day period of
Mhm.
symptoms. That's when we get into what we call that post concussion syndrome. So, Dr. Andrea, talk a
Yep.
little bit um, about what that can maybe look like for people, right? Because there's probably a difference between like, oh, when I at day 15, if I run a lot, I get symptoms, versus looking at my phone for 5 minutes gives me symptoms, right? So
Yeah.
talk a little bit about what might trigger sort of a diagnosis of like post concussion syndrome
Okay.
versus I still have some symptoms based on activity that I'm doing. If that, I hope my question makes sense there.
I think so. I'll try. So what we're kind of looking at in post-concussive syndrome. So some people, they'll recover, they'll be 48 hours out and they're doing good. Like things are great. They kind of healed pretty rapidly. The concussion was a grade 1. They sort of moved through. The body did because the body's smart as hell. Like this body's going to it's going to repair itself the best way that it knows how. So that's where, those people in like 48 hours to a week, they're doing good. They're feeling great. Then we have those people that tend to linger a little bit longer, even if it is a grade 1 or a grade 2 or grade 3, their symptoms start to linger. And it's because of that. What happens in the brain is we have neurons in the brain. What happens when we get hit is those neurons stretch and they create almost like a little pinhole where we have this like exchange of different ions. So what happens is we're getting that incorrect exchange going on. And if that continues on, if that person doesn't do the proper rehab, like rest in the beginning, and it used to be that we all recommended rest for a significant period of time, like rest, don't do anything, like don't activate your body, like you need to heal at rest, which is true to an extent. But now the research is coming out where it's actually, we want you to be active a lot sooner. So we want you activating those neurons. We want you creating new ATP, because what happens when our brain gets hit is our ATP doesn't dump. Like we have no, and that's why people usually when they get a concussion, they immediately want to sleep. It's because their brain just like went crazy. Those neurons fired off. They saw stars. They had this intense electrical activity event in the brain, and then nothing. And there's nothing to come in and feed that because the ATP production, the energy production isn't there anymore. So doing things, that's why some people have a little bit longer for post-concussive. Usually they've either had a concussion previously, and that concussion could have happened 20 years ago. It doesn't matter. It doesn't matter if it happened 2 weeks ago. It doesn't matter if it happened 20 years ago. You had previous TBI. So you already sort of have that sort of weakened state. And so you get hit again. That's a lot. If they have underlying health conditions, that's going to contribute to post-concussion recovery. And if they don't get in to see a proper practitioner who's trained in concussion rehab or recognition of a concussion, I don't know. I mean, I'm sure you guys have probably seen this where kids have maybe come in, or you've seen them and they got a concussion on the field, basically walk it off. You're doing okay. Like, we check you out. You didn't pass out, so you're okay. But it's later on, a week later, these kids are having behavioral issues. They can't focus. They are sleeping all the time. They suddenly can't perform the activities they were performing. And it's because they didn't get in to see somebody who is trained in concussion rehab. So that's where I think we get a lot of these long-standing concussion issues, is where people aren't having that early intervention as quickly as they should be. So I don't know if that answers the question.
No, it definitely does. And I want to throw a piece of that to Dr. Lauren here too. Yeah, that was a much better explanation of symptom limiting than what I gave. But yeah, there's a very shorter rest period now, usually within that like 24, 48 hour period. And then that's when activity is encouraged shy of those symptoms getting worse. Right. They're kind of working with the symptoms, but not pushing into that window. So, so talk about that a little bit, Dr. Lauren, about specifically in relation to some of the importance of that sort of stimulation shy of those symptoms, and how, if we don't recognize the fact that you need to be doing that soon enough, which I think, Dr. Andrew, is what you were really talking about, is, some of those people early on there might not need rehab for the concussion aside from just some guidance, right? So what is some of that stuff, and maybe some of those guidelines sort of look like, kind of in your experience? Like, what have you seen when that's gone well and gone not so well, Dr. Lauren?
So I really think it's case specific, because there's a fine line, and I always explain this to my patients, between kind of doing activity that is supporting your nervous system and healing versus doing activity that pushes you over the line and keeps you in that kind of hypersensitive loop, right? And it really, it depends on what your symptoms are and what your stimulating activity is, right? Because I don't necessarily tell my patients, sit on your phone until you don't feel good, right? Because sitting on your phone isn't supporting your nervous system to heal, right? It's seeing how long can I do this until I trigger my symptoms, right? But that's not how we support your system to heal. There are different things that we need to do to support the nervous system to heal versus just kind of throwing stimulating activity at it. And like what Dr. Andrea said, the body is amazing at healing, but the body is also amazing at compensating to get someone through the rest of their day, right? So yes, your body might do an amazing job healing to a certain extent, and then it'll get stuck. But because you're just pushing through your day, it's going to figure out how to work around the injury that it's experiencing. And when you work around an injury that you're experiencing, doesn't necessarily benefit you. Right? It leads to compensation. It leads your body to, trying to just get to the end of the day or get you from point A to point B. And that might be okay for a while. You might feel better for a few weeks. You might feel better for a few months. And then something else happens and bam, all these symptoms come flooding back because your body didn't correctly heal. So I I kind of see it in a couple different ways, right? There are people who feel better because their body heals. And then there are people who feel better because their body heals to an extent and then compensate. And then there are people who just don't feel better. And then, I typically see those people first. And then I see the people who didn't compensate well, 6 months down the line, and they're still experiencing symptoms. But it's really hard to tell you exactly what you need to do because concussion is so varied, right? But I think recognizing, maybe, I don't feel so great at the end of the day. Maybe that's your body telling you that it's not healing exactly how it's supposed to, right? Even though you can get through your day and you're getting your tasks done, are you doing it functionally in a way that supports your nervous system, or are you doing it just because your body doesn't have a choice?
Yes.
Does that make sense?
That makes loads of sense. I love what you said there about promoting healing versus just getting through the day, right? Like that's where a lot of this sort of, when we talk about early intervention with stuff like this, I think what we're really pointing to is recognition of it, so that we can have some guidance in that early stage or that early process of that, first week after the incident, to avoid needing further care, 10 days to 2 weeks out, or as Dr. Lauren just said, 6 months down the road, when these compensations start failing and things start showing up a little bit. So that's fantastic.
That was amazing, Lauren. Like, that was such a good point. Like, I say it a lot in my practice, like, our bodies are smart but not clever. So our bodies know exactly what it needs to do. It just sometimes doesn't know how to get us there. So it does compensate, which is an incredible, like, I love thinking about it that way. Like, you compensate enough to get you through to that next situation, because you're not going to die, but you got to get through the day. So the body gets you there. So that was such a great way to think about that. And definitely with concussion, and especially if it's more on, grade 1 or grade 2, where you can kind of push through, like, your body will allow you to, like, get up out of bed and move and do some things and get some stuff done. And you're like, why do I just feel so tired at the end of the day? Why do I have headaches more often? And then sometimes we convince ourselves that that's normal and that's okay. And that's our new normal, because that's just what's going to happen. And I think that's where, like, people like Dr. Phil and yourself and me, where we come in and we're like, no, that's not okay. It's not normal. Like, no, are you going to feel 100% all the time? Probably not. But could you feel 95% all of the time? Yeah, definitely. So
and that's our body's gonna let us know. And I think another good point to bring up here, as we're talking about this, is it is going to be a bit of an ebb and flow and a little bit of trial and error. Dr. Lauren, you hit the nail on the head with case specific. We can't give you hard and fast rules and tips in this discussion we're having right here, because it is very case specific. I've definitely had people and experienced people being great and seeing very steady improvements in what their symptoms are allowing them to do for like 3 to 5 days at a time. And then all of a sudden on day 6 or 7, they have 3 headaches again. It just goes backwards, because maybe the progression was a little too quick, or maybe they did everything right. It just, that's their body's healing process. And there's really no way to tell that.
Absolutely.
We still then need to listen to that and make the appropriate adjustments here. So no, that's great. So I want to take some of this a step further, because there are some other pieces aside from just people like ourselves who can help people sort of navigate this process. I want to talk about a couple of the other areas that we need to maybe focus in on, especially for those folks that are true post-concussion syndrome. So we're talking like kind of 2 weeks plus with lingering symptoms. And I want to focus on 2 specific areas. I'm going to prime both of you here with these couple areas, so we can be so we can all be thinking about these. Specifically the neck and its relation to what's going on with that neurological firing pattern going on in the brain. And then the other area is the vestibular system, our inner ear, and how all these things interact. So Dr. Andrew, kind of kick it over to you here. Specifically, let's kind of tackle the the neck first, because I think a lot of people are maybe surprised that maybe they got a concussion in a way, maybe the way that they got the concussion, they don't feel like they had a whole lot of like what they might describe as like a whiplash movement of their head. So why should my neck be something that I need to treat or work on, or why might that be a piece of my puzzle in handling this?
Oh yeah. I'm sure you guys have run into it too, where I've had people that come in and they're like, they told me I had a concussion, but I didn't get hit. Like I wasn't in a car accident. I just like slipped in my driveway. And I didn't actually fall. I didn't hit my head, but I came forward and backwards. Like we had that, I call it sloshing. We had that sloshing of the brain back and forth. And so they're really confused about why they're having, I didn't hit myself, because that's what everybody's been told for years and years and years. It's like, you have to be hit, like it's got to be this force, it's got to be that. And it doesn't. It can be something as simple as you slipped on the ice outside, caught yourself, but you had a jerk movement in your head. Or you could have something where you just, you did get hit, but it wasn't that hard. And you're like, oh, I just banged my head on the cabinet at home. Like it's totally fine. But I've had headaches for 6 months since then. It's like, okay, like there was an issue there. There was something that happened. And so what happens, especially with any sort of, hit to the head or whiplash or slip and fall or anything that's going to cause a concussion, it's involving the head. And what does the head sit on? It sits on your neck. Like, so you can't, and the body, we know, is a completely interconnected unit. So what goes on above is going to affect what goes on right below it. So, and especially where the neck is directly below it, you're going to have that jostling to the neck. So on a musculoskeletal level, you're going to have protection. The muscles are going to go to try and stabilize you. Super smart. Again, body's smart, but not clever. It's going to tighten up. What it should do is let go. What it's not going to do is let go. So it's going to still think you're in that fight or flight response. So it's going to lock into protection mode. You're going to have things as far as when chiropractic, we look a lot into the atlas axis. So the C1 and C2, the top two bones in your neck. A lot of the times with concussions, you're going to have a fairly decent misalignment of the top two bones of the neck. Those are cranial nerves. That's where there's a lot of activity with the brain and the top two bones in the neck. So those are something that we would address as chiropractors. And then looking into the tension in the neck and getting that to release, because once you've had a concussion, or and especially if you've had one that's a little more traumatic in nature, your body is protecting. It's going to lock in, and there's an emotional component that comes to that lock in as well, because you were suddenly once the super active person, now you're having all these crazy post-concussive syndrome symptoms, and that emotional component is going to come up as well. So we also look into addressing that. So
yeah,
that's what I got.
Yeah, no, that's fantastic. And I think you bring up some great points in my mind, just with the things that we focus on, Dr. Lauren and I, it goes to how some of those structures could then irritate some of our nervous system locally, that could cause symptoms very similar to headache, dizziness, visual disruption, that are actually from the nerves in our upper mid to upper part of our neck. And we might attribute to the concussion, but it's actually not from the concussion. So Dr. Lauren, I'm sure you've seen a little bit of this, maybe talk a little bit about how some of those imbalances we might have in our body prior to the concussion might actually overlap with stuff that happens in the concussion, and we have symptoms that might be hard to tell where they're coming from.
Oh, absolutely. That's one of the trickiest things, right? To figure out where exactly are these symptoms coming from. And a lot of times they're coming from more than one place. So it's very rare that I am seeing someone for concussion and I'm not addressing their neck, right? Because whether it's protective from the injury or even like one of these compensation things, right? Like I always feel dizzy when I look to the left after my concussion. So I stopped looking left without realizing it. And my neck is now really tight, right? So, that's another way the neck kind of plays in. But it's really hard for someone to tease them out, right? Because when you look at the vestibular system and when you look at the neck discomfort that might be affecting the nervous system, or you look at concussion symptoms, I mean, they all overlap. And a lot of times I spend a lot of my sessions with patients, you know, really asking them specifics about their symptoms, right? So I know where we need to address and things to go. And a lot of it is education on let's be more aware of what we're experiencing. Let's tap into our body a little bit more so that, you know, when I see you next, when I ask you this question, you may be able to answer it a little bit better.
Yeah.
So, you know, I do a lot of education on that. But yeah, I mean, the symptoms overlap, and you have to address all areas. And sometimes, you know, you don't necessarily know where to address, and you have to start with one, right? See if the symptoms improve there. And great, if they improve there, then we go to the next part. And I usually just pick the part that's most symptom provoking to start, right? And there's different ways to kind of tease that out.
Yeah.
I don't know if that's answering your question.
Yeah, no, that's perfect. That's exactly what I was looking for, is because some of these imbalances develop from the concussion, as you and Dr. Andrea both talked about, but some imbalances that can create things like headaches or even neck pain that can come after concussion, or any of these other myriad of or combination of symptoms that we could see could have been present before the concussion ever happened. And then we kind of have a straw that broke the camel's back situation. And when you've got headaches coming from the TBI that caused the concussion, and also coming from nerve irritation in the upper neck area, you've got a real headache there. That's not just like a ×2 headache. That's like an exponentially worse headache for that person. So it absolutely does need to be teased out in one way or another. And I think what you kind of started talking about there is a perfect segue to sort of our next segment here. And Dr. Lauren, I want you to kind of tackle this because you're already headed down that road, was that connection between our balance centers in our inner ear that can be affected from a blow that might cause a concussion, but can also be like a secondary neurological deficit following a concussion, and its relation to the neck as well, because that right there is one of probably near the top of the list of some of the reasons why people have lingering symptoms in a concussion syndrome situation.
Yeah, so the vestibular system is very interesting. So if people don't kind of know what that is, it's our balance center in our inner ear, but it's also our, how can I phrase it? It's the part of our body that helps to tease out when there is conflict, right? So I always say my balance is composed of three things. It's composed of my vision, it's composed of my proprioception, which is where my body is in space. So like my brain knows my arm's over my head, doesn't have to look at it to know it's there, it just can sense it. And then my vestibular system. So when there's conflict between the proprioception and the vision, the vestibular system is what comes in and says, nope, this is what's going on, and this is, you know, helps you experience the situation correctly, right? So when you have a concussion, because you have so much stimulus coming in, a lot of the times the body will dampen that vestibular system, right? And I think that's a protective mechanism, right? You have so much coming in, your brain is going kind of wild with everything that's been going on. And the conflict resolution there to make you feel better is let's dampen it. But when you dampen it, then you can kind of process the information that comes at you during your day-to-day life, and then you further experience symptoms. Am I making sense?
Yes.
So yes, okay. So that, you know, that vestibular system is so important. And I think a lot of times that when that dampened vestibular system hangs around, that's when you're going to have those symptoms linger on for a long time. And sometimes that vestibular system will stay dampened until we challenge it to rise back up to the level it needs to be at.
Yep.
And that's where kind of that physical therapy portion comes in, right? We have to wake that system back up. We have to tell it safe to work, right? And we have to give it situations where it has to correct the conflict so that your body is then able to kind of navigate your environment appropriately.
Go ahead. I was just gonna say that's a huge point, because that's what I found in these folks. And looking at the research, I think it kind of backs it up too, that the symptoms if the vestibular system is part of your post-concussion situation, it's really not showing up potentially a long time down the road. Like you might not have lingering. That's one of those situations where the symptoms you might not know there are lingering symptoms when that's your problem in a post-concussion syndrome, until you really stress it. Right. And then people don't know that that's what it is until someone's able to like narrow it down and tease it out. Right. Yep. Because they think, oh, my symptoms are just coming back. Right. So I think that's a real key point, that if someone is experiencing some of this stuff and you've looked at the neck, you've looked at, some of these other components, and you've done what you need to do, what you believe you need to do neurologically, that's a pretty big missing piece for people sometimes. Cause it's, unless you're seeing someone who's really trained in the vestibular system, like a audiologist or an ENT or something like Dr. Lauren here, it's going to be a lot harder to tease out there a little bit. Yeah. And then Dr. Andrea, my mind also goes to some of the neurological components and how things are talking between the vestibular system, the brain, and that neck area.
Yep.
And I know that that's an area that you're really big on is what areas in the neck we're looking at in these situations that help all of those things talk better, so we have less of that dampening compensation going on.
Yeah. And it's like Lauren was saying, with the vestibular system is interesting, especially when it comes to a concussion, because there can be so many things. So it could just be, a BPPV issue. So benign paradox. It's a little late for me to be pronouncing that today, but it could be damage to the vestibular cochlear nerve itself. So the nerve itself could be damaged, which is a whole nother ball of wax that we get into. And then you can have an imbalance in the fluid that's supporting that area. So when you're talking about teasing out, like, what is the issue? And that's why, going to a trained professional is so important, because there's certain tests that we do. There's certain symptoms that we know. There's certain words that patients say that, like, if a patient comes to you and they say, I'm dizzy, and it's like, well, are you spinning or is the room spinning? Like, those are questions we have to ask, because it's a very different thing when one or the other is happening. So things like that. And then we get in, as far as chiropractic, we're looking into the alignment or the position of the vertebrae within the spine. And we have things called, we call them subluxations. Other people call them misalignments, whatever you would like to call it. You have a subluxation or a misalignment of those vertebrae, you're going to cause an abnormal or dysfunction into the nervous system. It's going to put either pressure or a change in how that nerve is communicating with the brain, the vestibular system, everything. So that's what we check into. And by hopefully correcting that misalignment and creating what we call a holding pattern, so you're holding your adjustment versus it keeps coming out over and over again. And that's why I love working together with physical therapy and chiropractic, because a lot of people think we do the same thing and they're very different. So
different in the same all at the same time.
Exactly. Exactly. So that's why I love working with people who are trained like you and like Lauren in that vestibular system, because you guys can create different areas where healing can occur, where the adjustments that I'm doing are holding and helping out with that holding of that adjustment. But yeah, so correcting the subluxations and removing that nervous system interference just allows, I always say to my patients, like, a body free of interference is a body that can heal better. So it might not necessarily take your pain away instantly. It might not necessarily fix the issue, but it's going to create that cascade of healing that's going to happen, which is what I believe you guys also, like with PT, like, you're creating an environment where the body can heal. So you're just giving it the information it needs to do that. So
absolutely.
Yeah, that's where chiropractic would come in.
Yeah. No, fantastic. No, that's great. Yeah. Anything else to add vestibular wise there, Lauren? Anything that kind of popped into your mind in that part of the conversation? Because I know it's your jam. So
Oh, I mean, I know I didn't even get into the specifics of like positional vertigo versus a hypofunctioning versus, the cervicogenic component. I mean, it is very in depth. And, some people, it's a quicker fix than others, really depending on what you're presenting with. But I really like what Dr. Andrea was saying there. Like, I always try to create a relationship where I'm a guide, right? I'm just going to help guide your body or guide you to help yourself when it comes to healing. And right, your body, your body's smart but not always clever. I love that. I'm going to start using that. And
Stealing.
and the
Go for it.
vestibular system, the vestibular system really needs a guide. I have found that like it it, it will stay dampened. And you will just learn to compensate. It's one of those things that I don't think self-limits. I don't think it goes away on its own. And I think the longer you wait, the longer it takes to bounce back. I mean, it's still possible to bounce back 2 or 3 years after concussion if you're still experiencing symptoms because your body and the neuroplasticity is absolutely incredible. It just needs that push. But the vestibular system, in particular, really thrives with a guide, I would say.
Yeah. No, I think you did hit it on the head. And I think that really is kind of the big take home message here. Cause we could probably spend like a 3-part series podcast episodes
100%.
of concussion, neck and concussion, vestibular system and concussion. And we could have like 3 episodes within each of those 3 things. So without diving too much into the weeds here, I think the big take home message is early detection of a concussion that has actually occurred is the number 1 thing we need in these scenarios. And then the number 2 thing is having the guidance throughout the healing process. Because if you have that guidance and some of these things can be caught earlier and worked on a little earlier when we get to that activity phase, 3+ days out of the injury, we can prevent you from ever getting to a post-concussion situation. So if you're a longtime listener to this podcast, we've harped on prevention before. And this is exactly one of those things, because if we handle things right within the first week to 10 days of a concussion, the odds of it getting to a point where we need to tease out all of these little things is going to diminish. But if we're working through that process and you're working with a guide or guides through that process early on, we're going to be much better at teasing that out as it happens, rather than trying to wait until there's 20 different layers that we have to wade through to figure out what this process looks like. So that's my big take home. Dr. Andrea, I'd love to hear kind of what your kind of overarching like advice you give in these situations to people is.
My big things, because this year it's been actually a larger year of concussions with my younger patients. So it's, young adults and kids under the age of 20 getting hit in sports. And most of the time there's a little more early intervention just because they have parents, they have this, they have that are on them. But that early intervention is so, and concussion screening protocol, like if you get hit on the field, if you get hit somewhere else, if you go to the doctors, you need to tell them, I believe I have a concussion, or this is the injury, this is what happened. And performing, like for kids, we do a SCAT. I think you guys do too, SCAT 5s. Like we do the SCAT 5 concussion protocol screening just to see what their baseline is right after the injury happens, so that we have a guideline to go from there. So early detection, early intervention is going to be really important. And that's all there is to it. There's really not that much.
Yeah. Lauren, anything else to add?
Sure,
there?
I'll take it from the other side of it, right? So, I mean, say you're 2 years out of a concussion and you get a really bad cold and all of a sudden your symptoms come back. Like, these aren't things you have to suffer with, right? I really don't like the phrase, I'm just going to deal with it, or I'm just going to live with it. Like, it's my injury was so long ago, there's nothing I can do about it. I don't think that's true. I think our body can heal at any stage of the game. I think you can be 98 and still heal from things. So don't be discouraged if you're listening to this and you're like, oh, I've been dealing with, eye fatigue at night for the past 4 years. I mean, it's just too late. I can't do anything about it. That's absolutely not true.
Yeah.
So still feel
Not true
empowered to
at all.
advocate for yourself, right? There are things that can be done. So if the early intervention was missed, it's not the end of the world. Let's figure out a game plan and get you where you need to be.
Yeah. Fantastic. And I do love, Dr. Andretti mentioned this, but the team approach is super important here, especially for the population, Andrea, that you were talking about, the kids in sports. There really has to be alignment on this process, from the providers to the coaches to the parents to the kid. Like everybody has to be on the same page at all times with all of this for it to work in that early intervention stage and in that late intervention stage that you were talking about, Lauren, because anytime I always tell everybody this, anytime there's nerve or neurological tissue involved, we are kind of at its mercy as far as how it's going to respond to what we want to do. Right. So we've got to be doing all the little things right all the time. And it might take us some time to figure out what all those little things and what the right way to do them is. But once we find it, we better lean into it as hard as we can, because that's the only way we're going to see the change we want in this process. So, so that's fantastic. Well, thank you both so much for joining me for this discussion. I love talking to people smarter than me about stuff that I love learning about too. You both are great. So thank you both so much for taking the time to have this conversation, because I don't think enough people are having it in a way that's very accessible to the general public. And that's really what we're trying to do here with these podcast episodes. So thank you both so very much. I really appreciate it.
Thank you.
Thank you.
Yeah.
Awesome. Well, and thank you all out there for listening. Go make it a great week, and we'll see you back here next time on the Strength for Your Purpose podcast. Bye.